So before we award the certificate of recognition, let me read the citation first. The Research Publication and Innovation Center and the San Pedro College Community Engagement and Extension Services at San Pedro College. A certificate of recognition is awarded to Ms. Mirasol L. Magalasi, the SACADEM President, in recognition of the utmost partnership and never-ending support to the research and community engagement of San Pedro College, given the 4th of May 2023 at the Philomene Labrador Hall, San Pedro College, Davao City. Signed by the Research Publication and Innovation Center Director, Elsa May D. Baron, LPT, PhD, Sir Remart C. Mortalia, PTRP, MSDA Director of Community Engagement and Extension Services, and of course our very own President, Sister Aida T. Francilio OP. May I request, Ma'am Mirasol.
This is the certificate that I received.
The same certificate is awarded to Carmen Integrated School. I called in Professor Robert Ariate to receive the certificate.
Kailangan magbuwan ako ng ulo ng dito. Basta yung kita yun. Balik-balik kang dyan. Malayo-layo kamay.
Last February 25, 2023, the Department of Health, National Youth Commission, UNICEF, and YPEER granted volunteer service providers to the organization of San Pedro College to spearhead the project implementation of the Kuala ang Eskwela sa Respapuno project, which aims to provide an opportunity to hold COVID-19 vaccination, but not 5 to 11 and 12 to 17 years old for the primary and booster doses. Ladies and gentlemen, let us focus our attention on the screen as we witness the video that encapsulates this meaningful project. When we took the plunge to take part in the Kabayanihan Youth Challenge on COVID-19 vaccination, we were aware that many organizations were also competing, Even though we knew there was a chance in what we selected, we poured our hearts and souls to come up with a truly original project proposal out of our passion for service.
Sa way of implementing or sa method or sa technique na ginamit namin, first we use the mobilization, social mobilization. Ikipag-partner kami with barangays, schools, PTAs ng schools, SKs, and barangay health workers.
So our organization mobilized a total of 81 volunteers, and we started the planning and of this project from December up to February, and it was implemented on February 25, 2023 from 8 a.m. to 3 p.m. We partnered with a total of 4 schools and 3 barangays.
We are in a COVID year, actually, hopefully, and this will be the last year. And the only thing that we have to boost is for children or everybody to have vaccination against COVID.
So the COVID-19 vaccination has always been a priority for the City Health Office since the vaccines were made available.
Nakakatulong yung vaccination at least nowadays still, although hindi na masyado ganun ka-intense ang pandemic, but at least with my child na vaccinated, mas safe tayo.
So, bilang parents, magdadong na kami ng vaccination. As long as kaayuhan sa bata, para po sa bata ang ayuhan ng COVID vaccine. Although na siya mga side effects, pero kung makaya sa inyo na bata, wala yung problema. Depende rin sa sikat.
Ang UNICEF Philippines kasi ay naniniwala kami na dapat patuloy na tinataguyod yung karapatan ng mga bata at kabataan, kasama na doon yung kanilang right to meaningful participation in all matters that affect them. Through this initiative that we call Kabayanihan COVID-19 Challenge, we work with the Department of Health, Health Promotion Bureau, National Youth Commission, and YPR Pilipinas to create safe spaces for young people like the students of San Pedro College to meaningfully participate in shaping a more inclusive COVID-19 response.
So Youth Peer Education Network or YPeer Pilipinas is the largest network of youth-led and youth-serving organizations and passionate youth volunteers working in the advancement of the young people. Siyempre, in partnership with the various organizations and also community-based organizations, we empower and facilitate timely and creative innovative youth initiatives.
San Pedro College has been helping the government of Davao City in the vaccination program for its constituents. With us now are around 80 student volunteers and more or less 5 alumni and friends in order to make this program a successful one.
To get to this point required quite a roller coaster journey, but we made it. The following are the list of awardees to be awarded. For school partners, we have our winner, Capitan Tomas Monteverde Senior Central Elementary School, for having the highest number of vaccinees during the Kuala ang Eskwela sa Res Bakuna COVID-19 vaccination drive. Congratulations, and let us give them a warm round of applause. have our winner, the Red Cross Philippines Davao Chapter, for their exemplary leadership and compassion for health as the partner organization during the Eskwela ang Eskwela sa Res Vacuna COVID-19 vaccination drive. Congratulations, and let us give them a warm round of applause.
Once again, let's give a warm round of applause to our partner organizations. Thank you, Sister Aida, for gracing us with your presence today, and most of all, ang mga kaubanan din ng mga partner organizations. Thank you for taking time this afternoon. Also, the ones that we had a while ago was Hyacinth Ted, the president of the Volunteer Service Provider. At this time, to introduce our reactors, partners, and stakeholders, may I call in once again Mrs. Jonna Asa Marces, RSW, the Project Assistant of the Community Engagement and Extension Services. Ma'am.
Thank you, ma'am. Let me introduce to you our reactors this afternoon activity. Actually, we have 4 batch of reactors. For the first batch, we have Ma'am Mirasol El Magalasin, the President of Sacadab Itubo District. In behalf of Honorable Cinderella Dumagan Diaz, the Barangay Captain of Terendam, we have here the Magawad for Family and Community Development, Kagawad Hill S. Lopez of Barangay Tanandang, Tubog District. And also we have here the Principal of Carmen Integrated School in Barangay New Carmen, Tubog District, Professor Robert Ariate. For the second batch of reactor, we have Professor Belindo S. Aguilar, the Director of Student Personal Services, San Pedro College. For the third batch of reactor, we have the Principal of the Senior High School Department, San Pedro College Main Campus, Professor Allen Sayas Tan. For the fourth and last batch of reactor, we have Pastor David Tan, the member of SPC Research Ethics Committee. A big round of applause to all our reactors. Thank you.
Thank you so much, ma'am. So, handa na ho ba tayong lahat? Ayan, may mga pa-thumbs up sign po dito. So the presenters, I believe, are ready. The panel of reactors are also ready. And of course, the audience. We are all born ready for this. So ano pa bang hinihintay natin? Let us now keep the ball rolling as we now call in the first batch of presenters. Starting off with the impact of a community-based intervention program on the knowledge, attitude, and practices of adult residents with hyperglycemia in Barangay Talandang, Tubog District, Davao City, by Professor Cristela Candelario, Professor J.C. Bandala, Professor Josephine Coahotor, and Professor Melvin Misoles. The ones that will follow them would be the Lamdagi si Carmen, Tabangi si Carmen, a program development in response to the education, health, and welfare of the students and their families in New Carmen, Tubog, Davao City. Studied by Dr. Amsefa Bentayo, Dr. Janice Sawe, Professor Rosa Midel Libot, Professor Angeli Librea, and Professor R.J. Arsena. We also had the Total Quality Management Approach on Sacadab Livelihood Program by Dr. June Prieto and Dr. Julian Misty Ingilio. And finally, for this batch, we have the molecular detection of bacterial species from ectoparasites of bats visiting green spaces. Deciphering Role of Bats as Reservoir Host of Bacterial Species by Professor Marian Dara Tagoon, Dr. Vanessa Kalimbo, and Dr. Elsa May Barrot. Let us all watch these videos.
Good day, esteemed members of the panel. My name is Cristela Candelario, and together with my colleagues from the School of Medical Laboratory Science, Professor Josephine Balfour, Professor J.C. Bandala, and Professor Melvin Isones, we are pleased to present our labor of love, which is none other than our MLS Research Development Extension Project entitled Impact of a Community-Based Intervention Program on the Knowledge, Attitude, Practices, and Fasting Blood Glucose of Adult Residents with Hyperglycemia in Davao City, Philippines. One of the risk factors for developing diabetes is hyperglycemia or high blood glucose level, which is seen in prediabetes. Patients with prediabetes have a fasting blood glucose level between 100 and 125 milligrams per deciliter, whereas values above 126 milligrams per deciliter would already indicate diabetes. Figure 1 shows the many factors that contribute to the development of hyperglycemia, which can further lead to diabetes and other complications. In type 1 diabetes, there is deficiency of insulin, while type 2 diabetes is characterized by insulin tolerance. The nucleus of the present study is the community of Barangay Tarandang, Buwak District, Davao City. As of 2020, the neighborhood has a population of 3,750, which represents 0.21% of the total population of Davao City. This study aimed to determine the impact of a community-based intervention program on the knowledge, attitude, practices, and fasting blood glucose levels of adult residents in this community. Specifically, it aimed to answer the following questions. What is the social demographic profile of the participants? What are the pre- and post-intervention clinical features among the participants? What are the pre- and post-intervention levels towards hyperglycemia among the participants in terms of AAP? Is there a significant difference in the pre- and post-intervention levels? And is there an association between the post-intervention fasting blood glucose results in terms of their AAP? Figure 3 presents the conceptual framework of the study, which refers to the pre-intervention phase as the initial input, followed by the intervention proper, crafted according to the baseline results, and ending with the post-intervention phase to determine if there is a significant difference and association among the variables.
As for the methods, a quasi-experimental pre-test, post-test design was employed to evaluate interventions without the use of randomization by demonstrating causality between an intervention and an outcome of interest. The participants must fit the following criteria: must be a resident of Barangay Tarandang, must be 18 years old and above, must have a fasting blood glucose level above 5.6 millimos per liter or 100 milligrams per deciliter, and must be willing to be enrolled for the whole duration of the program. The study adopted the Knowledge, Attitude, Practices or KB questionnaire by Hyder et al. 2021 and composed of 30 questions, 10 questions each component, and translated into vernacular and underwent content validation by experts. As for the data analysis, the following are the statistical tools employed: descriptive statistics, test for normality, test for difference such as a pair test and Wilkinson time-bound test, test for association, and the study made use of the SPSS version 28 map, and the p values less than 0.05 were concluded statistically significant. The study has started the EPI's review and preparation of materials or documents last September 2021 to November 2021. And last December 2021, there was no signing. As per January 2022, Phase 1 screening phase was conducted, which consists of FPS, urinalysis, and KP survey. The intervention phase started with the diabetes education last February 2022 with medical doctors or medical checkup. And last March 2022, fitness education with registered physical therapists with live demonstrations were conducted. And last April 2022, nutrition education with registered nutritionist or dietitian for one-on-one nutrition counseling was also conducted. And the last part for the intervention phase, last May 2022, a house-to-house visit or monitoring with barangay healthcare workers and CS staff was also conducted, from which opportunity to educate family members of participants was provided. And as for the post-intervention phase, which is the last phase, it consists of repeat fasting blood glucose, urinalysis, and KP survey. A short Thanksgiving and graduation ceremony was held after the program. And lastly, last July to August 2022, a preparation of final manuscript and an exposure review was conducted.
City the results. Now, a total of 19 adult residents with hyperglycemia to 7% in a subjective of 1, which shows the social demographic profile of the participants. Therefore, more than 50 years old in age, male, married, Catholic, registered secondary school, were unemployed, do not receive a monthly income, and wear a group. Next for table 2, which shows the clinical features of the participants before and after the intervention. Now, during the pre-intervention phase, the average fasting blood glucose result of the participants was 10.73 millimoles per liter. indicating that they had hyperglycemia and were eligible to participate in this study. In terms of urine analysis, most of the participants had urine characteristics that gave abnormal limits. However, urine protein and urine glucose were positive in 13 and 6 participants respectively. Upon post-intervention testing, the decrease in fasting blood sugar result can be observed. The average number of participants reported at 8.99 millimoles per liter. Overall urine for clarity, pH, and specific gravity results seem to remain competitive. With 6 and 5 participants findings from tested hospital urine protein and the amounts was different. Although the 10 of the participants were still considered overweight, only 4 remained obese in the police proposal phase from the 6 who were during the pre-intervention phase. Next, we have figure 6, which portrays the knowledge level among the study participants before and after the intervention. Now, looking at the baseline result, all 19 participants had poor knowledge about hyperglycemia and diabetes. This changed upon follow-up where only 12 participants remained with poor knowledge, while 4 participants managed to score an average knowledge level and can attain a good level of knowledge. Next, figure 6 depicts the actual levels among the participants of the study landscape. Many participants fall under the category, which means that they generally lack positive or negative views about their condition. In fact, this mindset increased from 10 participants in pre-intervention phase to 11 participants in post-intervention phase. Interestingly, there is also an increase in positive interest from 4 participants in phase 3, 6 participants to qualify. The participants with strongly negative attitudes about their condition may be more severe. Next, figure 8, which describes practices levels of participants as grouped according to levels. Now, what can be perceived is that none of the participants had really poor practices towards their condition pre and post intervention. Majority of the participants instead started off with good practices, with some 6 participants eventually achieving very good scores later from immediately during the pre-intervention rates. Questions relating to exercise and diet were asked for this portion of the KFT question. Is table 4, which indicates the baseline and follow-up scores among the participants of the study based on 4 parameters. Now, the median pre-intervention fasting blood glucose result was 8.80, and the post-intervention result was 7.0. As per the workup exam test, this indicates significant progress. Now, the p-value of 0.002, which supports our hypothesis. The recording the results a significant difference can also be seen between the pre-intervention and post-intervention of the knowledge levels. By adults 45 classes as well. However, the levels of attitude and practices among the participants do not have any significant difference pre and post intervention. Therefore, the hypothesis for these period subjects were not supported. Next, for table 5, which shows association between post-intervention KFT levels and fasting blood glucose results of the participants. The between knowledge and fasting blood glucose, Spearman rule was 0.459 with a p-value of 0.048, which indicates a significant moderate positive correlation between the variables. This result supports the hypothesis that there is some association between knowledge and fasting blood glucose levels post-intervention. However, no significant associations can be distinguished between the attitude and fasting blood glucose and practice and fasting blood glucose results. Therefore, evidence for these hypotheses of these variables cannot be provided in this study.
Okay, for the discussion, the results demonstrated the positive effects of health education on the knowledge levels among the participants. This study found a significant increase from a mean score of 5.68 pre-intervention to a mean score of 9.69 post-intervention. Similar findings using educational materials can be seen in the works of Bloom and Kegels in 2014 and perhaps in 2020. As for the attitude levels, among the participants, no significant changes can be observed, although an increase can be noticed before and after intervention, and this ultimately was not significant enough. This finding is consistent with a cross-sectional study of adults attending the diabetes education program in Brazil by Rodriguez in 2009. In terms of the practices level, the participants reported having good levels pre-intervention with a slight decrease post-intervention. The need to maintain active lifestyle and good practices to prevent further complications of hyperglycemia were emphasized to the participants during the course of the intervention, which may have influenced the sustained good practices. Another important finding were the changes in fasting blood glucose levels among the participants. A significant increase between the pre- and post-intervention results was revealed. Furthermore, a positive association between the post-intervention knowledge levels and fasting blood glucose results was exhibited. And these findings provide evidence for the impact of community-based intervention program on the knowledge level and fasting blood glucose results utilizing health education and promotion approaches. For the conclusion, this study was the first to the author's knowledge to evaluate the impact of community-based intervention program for adult patients with hyperglycemia in southern Philippines. From these findings, it is evident that health education can indeed increase knowledge levels among individuals. It is also worth noting that the more knowledgeable an individual is, the more likely that significant changes in their glucose levels can be seen. In addition, improving attitudes and sustaining good practices among individuals with hyperglycemia may benefit from a combination of health promotion strategies that involve developing personal coping skills and creating more supportive environments. And here are the selected references used for this presentation. We are now ready for your comments, suggestions, and feedback regarding our study. Thank you.
Let us now welcome the next presentation.
Good day, everyone. Nandang si Carmen, tabang si Carmen. Our program development is in response to the education, health, and welfare of the students and their families in New Carmen, Tugbook, Davao City, is completed by researchers from the Teacher Education Department, namely Dr. Anseva Bentayo, Dr. Johnny Sawe, Professor Angelo Librea, Dr. R.J. Arsena, and yours truly, Professor Rosa Medel A. Libo. In behalf of the group, I will be presenting to you the paper guided by the following contents: introduction, objectives, method, results and discussion, summary, implication, conclusion, recommendation, and community action projects. Education in the Philippines is a challenge, most especially in the far-flung areas. There are records reporting population of the learners enrolled in public and private schools nationwide, but no data about the number of students who discontinue their studies. Family empowerment is considered essential. It is expected from parents to provide a supportive environment where their children are encouraged to study. Based on a study, parents can become teachers and nurturers for their own children. Capacitating them can be given by specific programs and agencies that strive to build trusting relationships with parents and help them build protective factors around their children. Health can also be one factor for reducing interest in education. It was asserted that education can be linked to health. An unhealthy child is at the same time problematic with behavior, and this is another determinant to consider. One of the adopted communities of San Pedro College, the Carmen Integrated School at New Carmen, Davao City, is located in the remote areas, and possibly the above-mentioned factors are possible to happen. The main goal of this project was to identify the prevailing factors concerning health and welfare that affected the interests of the students to study in the adopted community, which is the New Carmen Integrated School. Specifically, this project aims to address the following objectives: to create a positive and engaging school environment that promotes the health and welfare of the students, to establish community-based services and networks, to develop programs that promote the health and welfare of all those students. It helps ensure smooth transition and provide additional support to students who are at risk. and to provide a long-term, sustainable, and workable program or project responsive to the needs or concern of the adopted community. Hence, to attain these objectives, the following research questions must be answered. What are the participants' thoughts about the importance of education? What are the participants' thoughts regarding the main issues on health and welfare surrounding their community? What are the levels of needs of the adopted community in terms of students' education, parents' residents' communal concerns, and community support to students' education and welfare? From the results found, what programs can be designed? The study used the mixed method utilizing descriptive qualitative and descriptive quantitative in distinguishing and describing the needs of the adopted community. For the qualitative part, guide questions were used while a needs analysis survey questionnaire was utilized for the quantitative part of the study. Results found after thorough analysis of acquired data. Poverty remains a perennial issue of life in many places in the Philippines. In particular, those places that are hardly reached by the government aids, like the residents or parents of New Carmen to Bonglapu City. The reality is that these people belong to low-income families who rely on scavenging to earn a living. This persistent economic disadvantage negatively impacts the lives of the residents and their children, particularly in education. The results reveal that participants see education as essential to their children. Namely, they express that education promotes economic prosperity and develops capacity or competencies essential to improve one's social status and quality of life in general. However, despite these ideas, participants express that poor parental involvement, economic instability, poor academic self-regulation, and negative peer influence are reasons their children lose interest in studying. Further, the study unfolds that participants' children were not able to attend class due to the following reasons: family, conflict, economic instability, poor learning autonomy, and parental support system. In terms of issues on health and welfare surrounding their community, inaccessibility of potable drinking water, unhealthy air quality, and common illnesses were raised. The needs of the adopted community in terms of students' education in the community support to students' education and welfare on the table shown, it got a mean score of 4.6326 from both students and parents, which indicates very high level of need. The needs of the adopted community in terms of parents, residents, communal concerns got a mean score of 4.6885 from students and 4.6885 from parents. Both indicate very high level of need. This suggests that a well-designed programs of partnership for both schools and parents, especially for basic education, is considered vital, because if schools implement comprehensive programs and partnerships, many families respond even if they do not involve on their own. The needs of the adopted community in terms of community support to students' education and welfare got a mean score of 4.6326 from both students and parents, which indicates very high level need. This suggests that high-level community engagement and support services through partnership programs and activities help address various issues and likely ensure students' success at school. Community engagement is significant in light of the issues beyond the school's control and resources. To summarize, qualitatively, education is believed to be important by residents of New Carmen because it promotes economic prosperity and develops competency. Yet, some students are observed to have lost their interest in studying due to poor parental involvement, economic instability, difficulty in learning modality, and negative peer influence. Also, because of family conflict, economic instability, poor learning autonomy, and parental support system, students are not able to attend their classes. In addition, some of the main issues surrounding the health and welfare of New Carmen community are inaccessibility of potable water, unhealthy air quality, and common